Get your individual oral health hygiene so that you know what habits do I need to change, what do I need to do based on my lifestyle so that I don't get a cavity. But should you get a root canal, seek treatment and try and preserve your tooth. A tooth has three structures. You have the enamel, the dentine, and the inside of a tooth. The inside of the tooth is the part that feels. It feels pain, it feels pressure, it feels sensitivity. When that part of the tooth has been affected so much so that it gets sick or bacteria get into it, it now reacts, it becomes inflamed. And then once it gets inflamed, it can get to a point where it even dies. When we take a lot of sugar, lots of carbohydrates, either in our drinks or our food, and we're not able to clean them properly. So that's why regular brushing is very important. You're not able to remove those substances. Those substances react to the bacteria in your mouth to produce an acid. Some of us have acidic drinks, like we like all like herbal teas and fizzy drinks. So you're always having an acidic mouth that's etching away at your tooth. First, you'll have sensitivity for things you used to eat and had no problems. Maybe you are eating an ice cream or having a sweet and you're like, oops, there's something going on. It's not really pain, but you're not comfortable. Or when I start to bite on my tooth, I can't bite on that side. It's a bit tender. Or sometimes some people don't have any pain at all. One day you just wake up and your mouth is swollen. People say, I didn't sleep the whole night. I felt like my heart was throbbing in my mouth. It was just a pounding pain that wasn't going away. Or you have a pain that once it comes, it lingers, it stays for a while. It is true, some people, you can get your first visit and things are just wonderful, it's comfortable. And then you've been given the medication, but not all the inflammation has settled. So after your first visit, it's just crazy. The pain is just horrible. But with medication and following what your practitioner does, you can easily have root canal treatment that is painless. Some root canals, if the infection passes beyond the tooth, it goes now into the soft tissues, you have cellulitis, or it goes now into the different spaces, like you have pus that develops and goes into the cardiac sac, then you have problems with your heart and issues like that. It is true, a toothache can lead to your death. If you can keep your tooth, that would be great. So a root canal procedure would be a good way to keep your tooth and have a nice dental arch and still have a tooth that you can use. But most times you have other diseases that escalated into that. Like if you're not controlling your sugars, you find that you have severe caries, gum disease that can lead to a root canal. So root canal treatment is expensive. So if you can avoid getting the root canal, please go for it. Have your regular checkups, have your small cavities treated before they have any sensation. Should they have an sensation, have them filled and looked after. Get to the point of maintenance in your oral health treatment and avoid getting to the point where you have a root canal or you lose the tooth.